Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal, and this video will be the third video on my integrative psychotherapy models and psychotherapy integration. The theme for this video is schema therapy. So, what is schema therapy? Schema therapy is an integrative psychotherapy model that integrates in his ideas and the procedures and the way that the schema therapist works, notions from attachment theory, cognitive theory, psychodynamic relational theory, emotion-focused theory, and some of Gestalt theory and practices. So, schema therapy was created by a man called Jeffrey Young. Jeffrey Young is an American psychotherapist and psychologist. He is trained formally in cognitive therapy, and he also did some training in Gestalt therapy. Initially, Dr. Young worked with Aaron Beck, one of the fathers of cognitive therapy, in his institute in Philadelphia, US. In his initial work, Dr. Young was most interested in personality assessment. So one of his main research goals was to create an instrument or questionnaire that could evaluate personality. By the time that he was working at the Beck Cognitive Institute, and when he was immersed in his work, Dr. Young realized that cognitive therapy had a major disadvantage, for say, in personality assessment and personality disorders and personality disorders intervention. So, with that said, Dr. Young felt the need to complement his work with something else, and at that point he started to integrate notions from Gestalt therapy, the working with the parts of the self, with attachment theory, and some of emotion focused therapy and theory. At that time, cognitive therapy was more direction to thought process and to cognitions, and not so much in emotion. So, with that said, and with some psychodynamic relations theory, Dr. Young created something that would be called schema therapy. The notion of schema was initially created by Aaron Beck. So a schema, it's a network of thoughts and cognitions and beliefs and irrational beliefs and cognitive distortions that was created in the inside the relationship. For instance, a schema would be created in the interaction between the child and his parents, the child and his peers, and the child and the world. So you might find the notion of schema initially in cognitive therapy, but Dr. Beck didn't develop the notion of schema as much as Dr. Young. So Jung developed the concept of early maladaptive schema, or EMS. So, in this notion, a schema that would be maladaptive, like for instance, a child that perceives danger where it is no danger, or he perceives certain kind of relationships with his parents, like in the dependent mode, or a little narcissistic. So, in that time, the schemas were maladaptive. They weren't appropriate to the time, the place, and their interactions. These early maladaptive schemas, according to Jung, would be created in the child development, early childhood, and adolescence. If if it weren't considered a schema, a maladaptive schema. And when the child reached adult life or adulthood, the schema would be activated with inside a certain context or inside a certain relationship. So, in his work, Dr. Jung identified, I think, 19 schemas or 19 early maladaptive schemas. Also, that schemas would be the main focus and the main aspect of evaluation in his questionnaire. So, the Jung Schema Questionnaire is a well validated personality assessment questionnaire that we can use to evaluate the early maladaptive schemas. So, those schemas, for most part, can't be erased. However, the patient can learn to manage and overcome that schemas. And that's the main focus of schema therapy. And schema therapy utilizes tools from cognitive therapy, such as cognitive reconstruction or restructuring, thought analysis. So, as for example, we have automatic thoughts, and schema therapy intervenes on those thoughts. Schema therapy also intervenes in emotional regulation with experiential work such as the two chairs work, the guided imagery, some focusing, and schema therapy introduces the notion of schema modes such as the vulnerable child. And schema therapy acknowledges that those parts are functioning in conjunction within the patient. So the schema therapist's objective is to regulate those parts in some kind of negotiation and to teach the patient strategies how to deal with those parts. So this is really simple or really brief. I don't want to bother you with all those technical words. In essence, schema therapy was developed for personality disorders, as I mentioned, especially borderline personality disorders. And schema therapy is a validated and well proved efficacious therapy intervention, especially for personality disorders, but also for depression and anxiety, some humor disorders, for instance. As I mentioned, schema therapy was developed by Dr. Jung, but I would like to mention that schema therapy rose to recognition by a group of Dutch psychologists and Dutch psychotherapists that really took the work of Dr. Young, put it to research, and proved that schema therapy was efficacious and was a well-developed model for intervention. So nowadays we have schema therapy for adults, for children, for couple therapy, for groups. So there are very variables or very modes to work with schema therapy. And nowadays, schema therapy is continuously evolving. For instance, schema therapy assimilated some mindfulness work, for instance. So schema therapy is an evolving integrative model nowadays. So to close this video, I would like to leave you with a suggestion. This book called Schema Therapy, Practitioner's Guide, is the book that Dr. Young wrote with his colleagues, and it's considered the first manual for schema therapy. The latest edition of this book, I think, is from 2005. So recently there are more manuals and more articles and more work done in schema therapy, but this one is the essential and the original manual for schema therapy. It's a very nice read, and in this book Dr. Young explains the rationale for schema therapy, all those theoretical things that I said, and also the intervention part. So this is my suggestion for you. So I would like to thank you for listening and to see this video. My next video will be for emotion focused therapy. I would like to thank you for your time. I would like to say to be safe, take care, and I'll see you next time.